PCOS, a polycystic ovary syndrome, looks like one big syndrome, but there could be many types of PCOS one may suffer from. The first and the most commonest variety, of course, is the ovarian type, where the secretions of hormones from your ovary is not being appropriate because there are little cysts that form in the lining of your ovary. And those lining is from where your hormone, which is the male hormone and the female hormone, is secreted. Now, when the lining expands, the hormone secreting surface increases and you may have excess male hormone that is also secreted there, which then causes certain clinical signs and symptoms, which becomes the syndrome. In an ovarian type, you can have symptoms like your periods not being regular, you putting on weight. There could be signs like excessive hair growth on the face, which is more male type and not the female type of the peach fuzz that you see. You could end up having hair thinning, oily scalp. All of this could be a part of this one. Now, the other variety is the adrenal one, which is usually triggered by stressful lifestyle itself. So there, the androsterones can get excessively. Your doctor will be measuring something called as DHEAS in your blood. She could also do an early morning cortisol to check how the cortisol production is going on. So then you might have more issues like, again, hair fall, your excessive hair growth on the face. Obesity could be a part of it. One of the main things that you can also see probably is changes on the skin in terms of acne, which is a very, very inflammatory acne as well. And then you end up having yet another type which has insulin resistance in that, which means your body does not respond to insulin. The sugars are not sugar and insulin have a way of working at each other. That kind of gets disrupted. So there is insulin gets secreted, but because the body is resistant to it, more insulin gets secreted and more insulin gets secreted, which then leads to certain changes in your skin and body. Like probably one of the main things you will see is pigmentation on your neck, right? Which you think is dirty neck, but that's not. That's a part of insulin resistance. You might see small little skin tags on your neck, small little black dots like moles on your face, but they're not actually moles on your face. They are a little raised and you can feel them. So these are all things that can happen with insulin resistance, will then lead to your hormonal abnormality, because that again leads to the LH surge. So all this can be another variety of PCOS. The last variety of PCOS is in those people who have been on oral contraceptive for a really long time and then you suddenly stop the oral contraceptive. What happens is your hormone or your body is used to a definite meter dose of hormone every day, and then the ovaries kind of forget to see how to exactly secrete that because there's someone else secreting it, right? So it takes a lot of time then for the ovaries to get adjusted to someone not giving them the exact dose. So that period of adjustment, you might end up getting your PCOS as well. So there are all of these kind of PCOS, but one of the main things that actually cause your PCOS or stimulate your PCOS is wrong lifestyle. One is excessive sugar in your diet. 2 is excessive processed food in your diet. 3 is excessive different timings in eating. One may eat the right number of calories, the right kind of food, but if you don't eat it on time, if you don't eat it in the right amount of time that you're supposed to eat in the day, that also can cause your metabolism to go wrong and PCOS to happen. Main important thing among all of this is also stress. Some people end up saying, oh, but I'm not stressed, everything is fine. But there's a lot of stress that you're not aware of, but body is absorbing it. Stress can also be, if you don't sleep on time, body will get stressed. So even if you get 8 hours of sleep, but if you're not sleeping on time and getting on time every day, and your sleeping time is fully varying, that can cause body stress. So it is stress, it is your eating habit, it is your lifestyle such as exercises and the circadian rhythm that you are trying to maintain. All of this can cause PCOS. So please beware, and a lot of PCOS can be corrected by yourself by simply getting back to discipline. So that's what you need to do. I know this is PCOS week. A lot of us giving you a lot of gyan, but the main gyan that you will hear repeatedly people saying is that it is a lifestyle disorder. So please get your lifestyle under control. You can treat your own PCOS simply by getting back to a rhythm, to getting back to a discipline, cutting out on sugar, cutting out on calories, and then just getting your life in order. Do that for 3 months and tell me how you can cure your own PCOS. Yeah? Take care. It's not a disease. Don't get worried. You can help yourself. And of course, there are doctors like dermatologist, gynecologist, endocrinologist all of them who are equipped to help you treat the PCOS as well.